Ultrasound case review, and today's case is hemorrhagic ovarian cyst. So she was a 25-year-old married female with a regular menstrual cycle, coming with lower abdominal pain since 2 months. We ruled out two histories, that is no history of dysmenorrhea or no history of burning micturition present. We went with transvaginal ultrasound since her bladder was empty. Here we can see the endometrium within the uterus, which appears thickened. Also in this plane we can see the right ovary. Subjectively and by measurements it's bulky. And in left adnexa, here we can see a lesion in left adnexa. So we have to rule out whether it's ovarian lesion or a tubal lesion. Next, we tilted our probe to focus the lesion better. Once the lesion came into focus, we could get to know it's a cystic lesion with fine internal echoes. And here anteriorly we can see some echogenic septae. There's some mild free fluid also seen in pelvis. So this lesion had fine internal echoes and some thick septations along with some solid components which were clots because it had no internal blood flow on Doppler imaging. Next, if we observe, we can see that there is subtle enhancement of the posterior structures, that is pelvic fat and the bowel wall. This is because of posterior acoustic enhancement shown by this lesion. So our differential was hemorrhagic cyst versus endometrioma. Classically, hemorrhagic cyst has lace-like internal echoes. Endometrioma shows fine or ground glass internal echoes. We'll compare these classic images to our case. See, our case had both lace-like internal echoes in anterior aspect and fine ground glass internal echoes. So what is the diagnosis? Here we can see septations in our case. We can see some clots adhered to the septations in our case. Also these septations are lace-like and no color flow or vascularity either in the wall or in the septations or in the solid component appearing clots. So we go more towards hemorrhagic cyst. When in doubt, we can go for further investigation, that is MRI. So hemorrhagic cyst in MRI appears bright or hyperintense on T2 weighted images, whereas endometrioma shows classical T2 shading sign. This is nothing but high concentration of protein and iron in the altered blood due to recurrent hemorrhage will show hypointensity on T2 weighted images. This hypointensity can be of variable degrees of shading. Also we can see T2 dark spot sign, that is because of hemosiderin-laden macrophages deposition in a particular site on the wall of the endometrioma. Coming to the case discussion, hemorrhagic cyst is of two types based on the cause. So whenever there is hemorrhage within the corpus luteum or within a follicle, also known as functional cyst. So hemorrhage can occur either in corpus luteum or a functional cyst. This will lead to hemorrhagic cyst. This normally occurs in many cycles in all the females and resolves by 8 to 12 weeks. So imaging features depends on the age of the blood within the cyst. On ultrasound, we can see that hemorrhagic cyst will show lace-like internal echoes. Sometimes we can see dependent or non-dependent solid component which is echogenic, that is nothing but clot, or whenever it has concave borders it is called retractile clot. This is classic for hemorrhagic cyst. Also there will be no internal blood flow. If you find a hemorrhagic cyst, we have to advise for interval follow-up after 6 to 12 weeks on either ultrasound or MRI. Only if following conditions are present, that is if the cyst is more than 5 cm in premenopausal patient or a cyst of any size in postmenopausal patient is supposed to be followed up. So hemorrhagic cyst on MRI, as we discussed, on T1 weighted imaging it can show intermediate to high, on T2 weighted imaging high, and on contrast there will be no enhancement. Classic differential diagnosis is endometrioma, we discussed in detail, which shows uniform low level internal echoes, or also called famously as ground glass internal echoes. They show high signal on T1 weighted imaging and low signal on T2 weighted imaging, that is T2 shading sign, exactly opposite to the hemorrhagic cyst. Also we can see T2 dark spot sometimes. Other differential is ovarian cystic neoplasm. So it can show papillary projections or mural nodules, which will not be seen in hemorrhagic cyst. It can show nodular septations with or without vascularity of septations, and usually color flow will be present either in wall, nodule or the septa. Follow our page on YouTube and Instagram, Radiology Doodles, for more such videos. Please like, share and subscribe our videos and comment down for more such videos.